I know you guys are very hungry, and I'm hoping that watery-based soup did something for your appetite. I'll try and get some snacks around, but we have one last panel discussion. So please stay with me for that, because I think it's going to be very interesting. We had a doctor initially who had asked, India is full of vegetarians, and then you're telling me that we're the diabetes capital and that we are the coronary artery disease capital. So why is that? Now, with all these lectures, does anybody have an idea? Maybe one. I think this is a very shy group. Nobody wants to, I know that all of us did not know thyroid disease does not cause weight gain. I know that for sure. And millets, nobody raised hands. Okay, I'm giving up now. Any one maybe? I don't have gifts to give you guys. No? Okay, maybe I should have just lied and said I have a gift for the right answer. Maybe my MBBS students will come. Anyway, let me invite the panelists over. I'm very proud to say that I've got quite a few celebrity influencer doctors here. Quite a few, as a matter of fact. So I know that as doctors, some of us get really annoyed with these WhatsApp forwards, the social media, Insta, idu pannanga, adu pannanga, I think everybody knows Tamil, no? So I'm sorry if I'm switching back and forth. So, kalayila warm water kudinga, vendayam saapidunga. There might be truth to some of that, but is that the only thing that's going to really help you with your metabolism? So while I have these wonderful panelists here, we're going to do a couple of rounds where we just, give 1 or 2 questions to each of them. And then the last 5 to 10 minutes, I'll open it up for the audience so you guys can ask your questions. Please don't feel shy, because you're never going to get such a panel again, especially when we're talking about nutrition. I'd like to invite Dr. Nritya, family physician and lifestyle medicine physician from Sitapati Clinic and Hospital. She served in the Indian Army as a short service commissioned officer from 2000 to 2005. Shaini Surendran is a Chennai-based sports and preventive health dietitian with 25 years experience, founder partner of Art of Eating Clinic. Her experience varies from working in hospitals as clinical dietitian, lecturer in Srihar, besides being an author, columnist, and speaker. Dr. Priya Kalyani, Senior Consultant, OBGYN Director, Kana, Center for Assisted Reproduction. Dr. Monisha is a highly skilled dermatologist with a strong interest in aesthetic dermatology. She is the Medical Director of Armora Skin, Hair and Laser Clinic, Chennai. She is also the Chief Formulator for Keth Laboratories products. I'd also like to have Dr. Arun and Dr. Jayashree Gopal to add to our panel. Okay, one of the doctors initially asked about, the question that we are talking about, right? Vegetarian food, and how come we have so much disease? Does anybody here have an idea? You want to? Yes, please. Milk-based foods and cheese
dairy,
and
basically.
Fast foods, processed grains,
sweets, basically.
Those kind of things. Yeah, absolutely. So, right? Too much of carbs. I think Dr. Jayashree Gopal's slide said almost 70% carbs in our Indian diet.
And the food is not balanced.
It's not balanced, yes. So low fiber, low in vegetables, low in protein. Yeah. So I'm going to start with Dr. Monisha. She is an aesthetic dermatologist, okay? And I'm going to start with some of my vain questions. As we are all aging, I see a lot of young people in their 20s, I think, but a lot of us are in the 30s and 40s. And so we all want to age gracefully. So as a cosmetic dermatologist, a common problem we tend to see is hyperpigmentation and wrinkles. And hair fall is something we see again from young to old. I think all of us have gone through that at some point or the other. Does nutrition really work for these problems?
100% it works for these problems. When it comes to aging, we all know that collagen is one of the most important factor, and it is going to help in reducing aging. And collagen degradation happens with high sugars. And I think right from 2 to 3 years old, there is high sugars in our diet. So aging starts at 2 years of age with the first chocolate. So that has a very good correlation. Hyperpigmentation of late has definitely increased comparatively, and even adult acne. I don't think 10 years back adult acne was this common. Now it's as common as a teen acne. And probably they did not even have teen acne, but they end up getting adult acne. That's because of a big jump in the dietary pattern, especially the fast foods, eating untimed, probably because of the night shift works, and definitely the gut microbiome is totally gone for a toss, and that affects the acne too. Hair fall, 100% because of micronutrients loss. Every second person who comes with a hair fall has iron deficiency. And India is becoming a developing country, but we are going poor in nutrition.
So thank you. You did say, the one question that we keep getting is collagen, right? Collagen, there's so many products out there. And collagen is, again, typically what I hear is animal products or marine based. So how do, if this whole lecture is about plant based, how do I get collagen plant based?
See, for the production of collagen, you need vitamin C, zinc, selenium. So if you can manage to improve your collagen production with good amount of vitamin C rich fruits, vegetables, zinc, selenium with nuts and seeds, you can improve your collagen production. This is through plant based. And recently there are few researchers which is going on for plant-based collagen drinks too. And it's of course showing some good results, but we need even more good data to prove that it is going to work. One of it is made up of fermented amino acids. So that was pretty interesting, but it's very much in the early stage. But of course, to improve your collagen, if your vitamin C, zinc, selenium is right, and even the copper levels are good, your collagen production improves, because these are all precursor enzymes which are required for collagen production, and cutting down on high fat as well as sugar, which can degrade your collagen. So your sugars, fat should be low, and your antioxidants should be high. The balance should be there.
So that way you also slow down the breakdown of collagen.
Of course, yes.
Yeah.
So naturally, you retain your natural collagen well. Yeah. So the aging is going to go down.
Cool. Thank you. Dr. Arun has been on a whole food plant-based diet for at least 16, 17 years now. He's got a deep passion for health and nutrition and anti-aging and longevity. Recently we did hear about the Nobel Prize for anti-aging and telomere lengthening. What are a few pointers you would advise, and can you tell us a little bit about that study?
So, in general, right, what we don't realize is our lifestyle really affects our longevity, the rate at which we age, not just outwardly, but inwardly, right? And the whole anti-aging movement has been very interesting. It's not about living for a very long time, but it's about living as healthy as possible, avoiding the last several years of disability, etc. And also being functionally fit for as long as you possibly can. And, what is really, I would say, in terms of, if I'm going to summarize this part, right, what I would say is all the key pillars when it comes to lifestyle is, we've talked about nutrition at length. I think we've kind of beaten it to death, try to embark on a whole food plant-based journey. Make sure your supplements are pretty good in case you are on a strict plant-based diet, your iodine, B12, etc. Make sure we also see vitamin D levels to be very low, and that is something that is fairly common in our part of the world. So ensure that you get that part. The other things that are, I kind of touched upon that very briefly towards the end of my talk. It's about your sleep. It's about your stress management. It's about your social connectivity. It's about ensuring you do enough physical activity. That means at least 30 to 45 minutes of moderate intensity activity 5 days a week at least. So these all will help slow down the aging process significantly. And the whole area of like telomere lens, etc. I say at this point it's still like it's interesting, but there is no medication per se that will prolong it. Focus more on all the lifestyle aspects that we talked about.
Thank you, Dr. Arun. So when we talk about exercise, meditation, sleep, decreasing your stress, I think all these also play a big role in anti-aging. One of the big questions that we tend to hear about is, okay, I work out a lot, or I'm an athlete, or I'm a bodybuilder. So how is vegetarian protein going to help me? How am I going to build muscles? How can I do this? And don't I really need meat and milk to sustain my performance? I think I don't even have to say who the mic goes to. But I'm going to ask Mrs. Shiny to enlighten us about that.
Okay. Yeah. So we work with a lot of athletes. In fact, cricketers who are with the national team, as well as the IPL, TNPL, and there are a lot of vegetarians too. And it's just that a combination of foodstuffs, like so nuts and seeds, legumes, and then also just getting the complementary proteins. It's just about, if you're having idlis, make sure that your sambar is quite thick. It shouldn't be this watery sambar. Yeah, and then your coconut chutney can have some pottukadle in it. And then your adai and pesrat is a very good option. And besan chillas and your doklas, khandvis, all of that are very good options. And also there are vegan proteins. So plant protein is something that is peace protein isolate is quite common. And nutritional hemp is another thing that we do give. So hemp hearts is something that can be added. And of course, omega-3 is another important component. So even for athletes or anyone trying to reduce their weight, it helps a lot to give omega-3 fatty acids from vegetarian sources. So that would be walnuts or else flaxseed, including chia and sabja seeds. So just getting a variety helps, and then ensuring that the gut health is really good. So we all have heard about you are what you eat, but you are what you absorb is the new mantra. So the idea is to get around 30 to 40 different types of vegetables in a week. So make the best use of your weekend and put your pen and paper there and then plan it for the entire week. And every adult is supposed to eat around 400 to 500 grams of vegetables. Can I see a show of hands, please? How many of you managed to eat ara kilo kaigari? Okay, potatoes, yam, colocasia is not included in this list. Even then, yeah, same here. So, yeah, this is how it goes. And then also for gut health, fermented rice with buttermilk, that's the parai sadam. And all the kanji and the kuru and all that. So Dr. Jayashree mentioned about the fermentation and the goitrogens. So when you ferment all this, definitely it breaks it down. So it's a very nice way. I would say we both were talking about it. Our South Indian diet is so beautifully balanced. We just have to get the right proportion in. Yes.
So like Shiny said, idli podi mattu sapta pattadu, nalla or katti sambar potu balance your diet. That's why these things, this group of menu items was created by our ancestors.
Oh, I just wanted to kind of also state the obvious when it comes to telomere length and aging and avoiding the shortening with age. I see an increasing trend amongst all people, especially like I would say the Gen Next. There's a lot of vaping that's happening. So, I mean, it's kind of obvious, so I kind of just skip that. But don't smoke. Vaping is not risk-free at all. It does increase your risk of a lot of other things. So, you want to keep, keep your lens, like the telomere lens long, etc. Prevent aging prematurely, etc. Definitely don't vape. And given this diverse panel experts, I'm also kind of curious to maybe ask you about this, if that's okay. Sure. Intermittent fasting was touted as a very, very strong thing for, especially for preventing aging, right? I mean, personally, obviously, I was doing it a fair bit. I think the overwhelming amount of data would still support calorie restriction as well as, giving enough time for, giving the food-free intervals, really, for lack of a better term. The reason I'm not pushing it gung-ho is because there was just one trial there's an abstract that came out that made a lot of noise, where it showed that time-restricted eating actually increased cardiovascular mortality significantly. Seems to be an outlier, but I think we should just be a bit cautious as experts in terms of pushing it too hard. Every, I would say, biological model that's been tested, animal studies, and even I would say most of the human studies have actually supported it. But given that there's, and there were some other, when I saw this, I actually did a literature review of the whole thing. I saw there were some studies that did kind of refuted intermittent fasting as a longevity prolonging mechanism. So just be mindful of the space. I don't think we should get dogmatic one way or another, but I'm kind of curious to know what you think about this.
Yeah, I remember when it came out, and actually, similar thing came out in the Lancet about 4 years back, where one study came out which said that people who are on a low-carb diet had higher mortality. I don't know if you remember that. So I always wonder how much of this is industry-driven. Because at least the Lancet one, which said that low-carb diets were bad, if you went back and looked at it, the authors were people who had been paid by other pharma companies. Okay, and the group that was not on the so-called low carb were low carb because they were eating a lot of animal protein and fat, and then they said that a lot more of them were smokers. So obviously, even at a preliminary reading, it just looked like the study I presented about thyroid cancer and cruciferous vegetables. So I think ultimately we all need to eat less and eat less often. What you said, that we have to give the gut time to recover. So intermittent fasting, unless it is a forced intermittent fasting, so that may have played a role. I think that was also looked at. So if people were fasting because they were unwell, obviously that would increase the mortality rates. But I honestly didn't think much about that study because it didn't fit in with the...
And it's abstract. So
yes, exactly.
We haven't seen the manuscript, so it remains to be seen.
See, another thing is the definition of intermittent fasting for a layman varies. They think they can just eat anything within that window period. So biryani and bhaji, bonda, vadai, alcohol, everything. So if you eat within that 8 hours, it is supposed to melt away or vaporize. That's the perception that people have, which is ridiculous. And they might be sleeping at night, having tea and what's that, bun butter and jam at like 2 a.m. and 3 a.m. hot biryanis. So this is the kind of situation that we are facing. And another aspect is they wouldn't have gone to a professional to get a proper plan designed. And there are people who have their regular filter coffee in the morning and then they have their first meal at 12 and they still call it intermittent fasting. I think we really need to look into all these aspects, and I agree with Dr. Jayashree because who are the ones who are going to lose it, right? If you're going to be skipping breakfast and eating only 2 meals. Okay, so think hard.
Absolutely. I think we see that in our practices too, right? I'm sure we've had this question ourselves as we try and do more and more plant-based. I want to eat healthy. I'm going to include more plants and vegetables, fruits and vegetables in my diet. But then don't we get this question so many times from our patients? And I think we have that question too. How many of a family or relative has said, how can you get protein from just a plant-based diet? How can you meet your calcium requirements if I don't drink milk? And milk is a completely different topic. We can go for hours talking about milk and dairy products. So can I get enough protein and calcium from a plant-based diet? What are the common myths? I'm going to ask Dr. Nritya to take the question and give me some clarity on this. She's a very passionate lifestyle medicine expert, and usually when we have questions about what is the evidence behind it, are there research studies, we tend to ask Dr. Nritya.
So I think I think a lot of times we kind of focus on just one source of protein. Like we're thinking about getting all our protein for the day with maybe one food, right? So it is important to think about food completely. Everything has protein. Your vegetables have protein, your grains have protein, your legumes have protein, nuts and seeds have protein, even fruit has protein. Okay? So when you're taking a plant-based diet, it is important to include all of these. And not just, it's not that you just take dal or you just take something which you think is high in protein. if you consume a well-balanced diet where you are having all of these at every meal, I will say that vegetables are very under-consumed in our population. We tend to have vegetables only for lunch. There are no vegetables for breakfast and dinner. And it is very important to consume vegetables. They have to be there part of every meal. So as long as you're getting all of these, and the grains also should be whole grains. So your white rice, maida, I will not count it as a grain. Okay? So it is important to have a meal like that, and you will get your protein. So I'm not going to talk about, Dr. Shiny already covered the athletes, right? So most of us would require somewhere about maybe 1 gram per kg body weight, okay? And so 50 grams of protein is quite easy to get with a whole food plant-based diet. And as far as calcium is concerned, yes, milk is a source of calcium. And culturally, we are kind of geared up, we are brought up like that, right? From the beginning, as kids, it's very important to have that glass of milk. It's almost as if you don't have that milk, nothing ever is going to become all right. But you have a lot of other sources of milk. Ragi, as Dr. Jayashree said, ragi is something which is very commonly used. Ragi has got a very high source of calcium. So again, if we include ragi, chana, oranges, almonds, it's just that all these things are not touted as being high source of calcium. We only hear milk as a high source of calcium. So if you get all of this in your diet, you'll get everything. A plant-based diet does include everything. So if you look at animal protein, it'll come with fat, okay, and no fiber. And fiber is very, very important. Dr. Jayashree talked to us about the gut microbiome. The gut microbiome needs fiber, and you can get fiber only with plants. There is no fiber in animal food. So it's very important that we think of food as whole and not just focus on nutrients. And it's possible to get your calcium and protein requirements.
And what about the question that we get, plant protein is incomplete amino acid profile?
Yeah, so again, like
complete.
Dr. Shiny pointed out, if you just combine, so you will have some things which are deficient in one and some things which are there. Having said that, soy is a complete protein. I think buckwheat is a complete protein. Hemp is a complete protein. Quinoa is a complete protein. So you do have complete proteins even in plant.
Thank you.
So I just wanted to say that drinking tea and coffee in the morning is something which is about, 110 years old or 100 years old. The British tried very hard to convert us to tea drinkers. Those of you who are interested, go and look at the history of tea in 1910 and 15, because they needed to sell tea in India, right? So tea is not part of our diet. We were not, our great-grandparents did not get up in the morning and drink tea and coffee, and they didn't drink milk also. Yeah, so they probably just had curd and buttermilk at the most. So they did not have milk in the morning. Yeah.
PCOS and infertility issues have become a huge problem. It's almost saddening to see the number of infertility patients that we are seeing, both men and women. PCOS is a problem with the ovaries, or is it a metabolic disorder? And what is the connection between infertility in men and women and their food habits? Dr. Priya Kalyani.
So it's really surprising that infertility is so much on the rise despite us being the most populous nation in the world. But, and I really wish PCOS would be renamed, because polycystic ovarian syndrome makes it all about the ovaries, and all the mothers and the patients sometimes are bothered about are the scan reports which show cysts in the ovaries, which is how the doctors explain it to the patients, whereas it's really not required for the diagnosis. So it's a complex metabolic disorder involving multiple organs, and I'm sure all of us on the panel across all the specialities, it increases the risk of hirsutism, acne, which Monisha may see, diabetes and heart disease, and it has so many long-lasting implications, sadly, which are not even talked about, and we all concentrate on cysts, and the mother wants to know whether she can get the daughter married and whether the daughter will be able to get pregnant once she gets married. So we should be thinking about more about the long-term consequences of PCOS. It is a lifestyle disorder, and I often tell the patients, just giving you medication is treating the symptoms. It's like turning off, it's like mopping the floor without turning off the tap and not addressing the root cause exactly. So all of us see PCOS, and I'm sure what we do at least here is send them to a our lifestyle counselor who takes a complete history, talks about all aspects of their lifestyle, not only the diet, it's about the exercise, sleep, stress, which everything can contribute. And without addressing that, I would be just treating the irregular periods with contraceptive pills. I would be giving them ovulation induction for their infertility, and maybe putting them on metformin or other insulin sensitizers if they had raised HbA1c. So it is very important to look at lifestyle. And the second question being that infertility is on the rise both in men and women, and it has a huge part of it is due to the change in the lifestyle. So all of them are obese. I see young girls at 13 years, they weigh about 60, 70, 80 kg, and then when they come to me with period issues, probably they're going to get married at 20, early 20s. I see them when they are 90 and 100. In pregnancy, I see 120 and 130. It is very, very alarming what is going to become of the next generation. And the men are no different. I mean, everyone has sedentary jobs. They work night shifts. They watch revenge Netflix in the night to make up, and entertainment. They're missing out on their entertainment. So all late night habits, Swiggying and Zomato, everything is at the click of our fingertips. So yes, lifestyle has changed, and that definitely plays a huge role in the rise in infertility we are seeing nowadays.
Thank you, Dr. Priya. So I think with the entire CME, we've been talking about diabetes, thyroid problems, heart disease, PCOD, all huge metabolic problems where nutrition can kind of, help you get out of it. But, I wonder with certain other inflammatory disorders like psoriasis, lichen planus, is there, can nutrition actually help in these inflammatory disorders?
Yes, a lot. And there are a lot of studies which has shown that nutrition can help in reducing the burden of the disease, also reduce the lifetime of the patients being on immunosuppressants. Especially when it comes to atopic dermatitis, psoriasis and eczema. Eczema is a very huge problem. I think almost everyone has an eczema issue, and all three affects the quality of life. And all three doesn't have a permanent cure. Yeah. So it's about how much you reduce the inflammation. And when we talk about the inflammatory conditions, gut has a huge role to play. The gut-skin axis is very important, and it is important to have a very good gut microbiome, and so that the inflammation doesn't increase, the pro-inflammatory cytokines reduces and the anti-inflammatory cytokines increases. So that plays a huge role when it comes to inflammatory disorders. So even acne falls into the same page.
Right. The leaky gut and all the inflammatory disorders associated with
and
it.
And when the gut microbiome is not good, it also affects the skin's integrity. Like especially there are also studies which shows that the bacteria, the SCFA bacteria in the fecus is low in patients who have inflammatory conditions like psoriasis and atopic dermatitis.
Okay.
And this also increases majorly because of dairy and gluten.
Oh, that's interesting. Yeah.
Yes. So
Food
the major
intolerances.
intolerance is dairy and gluten. And good amount of micronutrients also plays a role. So when we say don't eat dairy and gluten, people think, okay, we're not supposed to eat any food. They think they are in a world where they are out of food to eat.
That's right.
Yeah, I just wanted to add that there are a lot of people who are not aware of the intolerance. They don't go for any testing, and they continue to have their regular dairy products in the diet. And the perception that if you eat chapati, you will lose weight. If you have wheat upma, you will lose weight. All these kind of thoughts. And again, there have been a lot of changes in the grain itself. Earlier, it was a diploid wheat, and then came the hexaploid, tetraploid, all of this. So basically, the idea was to help the farmer get more yield per hectare and also weather resistant and pest resistant grains. But then all these tweaking has actually damaged the gut to a great extent, and that's why there's generalized inflammation that goes unnoticed. That leads to leaky gut, and then of course, that if you do not fix it, then it leads to even autoimmune disorders. So I think it's very important to understand. And besides that, there's also peanuts. A lot of people think it's great to have peanuts as a snack, but then the aflatoxin there again is one of the major factors. So understanding food allergies and intolerances have a huge impact on psoriasis, eczema, dermatitis, so gut-brain axis.
All those GMO wheat varieties that we get, you wonder what wheat we are really eating. And I think in a majority of my patient population, when they come in with urticaria, hives, itching, the one thing that magically works for me is go on a lactose-free diet for 2 to 3 weeks and stop ordering from Swiggy, Zomato, and then let's reassess in a month usually tends to work. I'm getting old, so I can't really see my questions. No, I don't want your glasses. Okay. This one I was very curious about. Now, when we talk about a plant-based diet and we want to be really healthy, it starts becoming, like Dr. Nitya was saying, a very elitist group, right? Do I have to, where can I get my kale? How do I buy my blueberries? Avocados, that's like the norm. Where plant-based is becoming, that's becoming a fad diet too. We're all trying to talk here about evidence-based nutrition and telling people, do plant-based, do what's local, do what's regional. And then when we talk plant-based, we start saying, let's do kale smoothies and blueberries. So, Shiny, what is my local, regional, cheap sources of healthy plant-based food?
Yeah, so kale is not popular anymore, and I think every 5 years we have these foods, fancy foods that do its rounds. I'm sure all our dietitians here would agree with that. So even for the berries, it's so expensive. Just 100 grams is like what, 400 rupees?
Yes.
The blueberries.
Yeah.
And that's ridiculously expensive. You just have to eat naval param, which is easily available. It's in season right now. And I think amla, gooseberry is another one. And you go to any schools, right at the entrance, you will find elanda param being sold. Okay, so that's another berry, local berry. Then you have manatakali. So those. So you just have to look at the local ones. And then also it'll be fresh. It'll have a lot more. It hasn't traveled across seas to reach you, and then it goes to a warehouse, and from there to the various supermarkets, right? And again, whether it's refrigerated, then you go purchase it and keep it in your refrigerator for a week. So at the end of the day, are you getting that amount of nutrients is the question. So the idea is you can still eat what is available locally. You don't need to look for arugula and rocket leaves. You just have to eat all the different varieties of kira that's available, and also your pudina, that is mint and coriander and all the herbs that's easily available. And please, let's support the local farmers. In fact, there are rice varieties. There's one from Assam and Odisha. It's called Likiti Machi. And I'm forgetting the names, but then 10 to 15 grams of protein in ancient rice varieties. And people have actually revived close to 150 traditional rice varieties. You must have heard about Kuriyarchan, Tuyamalli, and Kavani Arasi and all of that. So there are other varieties too, which have quite a lot of protein. So you can still make your risotto because there's sticky rice and then a couple of other things. So your mapla samba can be made into a idli dosa batter, or else a puttu or a idiyappam or a paniyaram, and it tastes great. So it has qual and it takes care of anti-aging. So there are so many other benefits there.
Thank you for that. As a matter of fact, almost 10, 12 years back when I was in the US, I was just getting into this lifestyle medicine. I was very curious about the nutrition, so I would go look at these superfood stores. And so one day I went in and I bought for $30, I bought a small packet that said superfood from Africa moringa powder. Okay? And I bought it, and I didn't know what it was. And my 3 kids have been I try everything on them, the poor children. So I'm like trying to mix this word called moringa powder, trying to figure out what to do. It was bitter and all. And then my mother-in-law came to visit me. And oh, did she laugh. Because moringa powder is nothing but our murunga keera. Okay? But 12 varsham munadi, I did not know that. I fell for this fad and I spent $30. I still can't forgive myself for that. So along the same lines, there's a huge amount of controversy about soy products. Soy sapta, your estrogen levels go up, fertility is an issue, breast cancer is an issue, huge amount, lots of questions that I tend to get from my patients, from friends. So Dr. Nritya, what is your take on soy products? This tofu, you're hearing about soybeans. I think it's so easy to eat a soy cereal bar, so can I just get my protein that way?
Yeah, you can, and there are a lot of studies being done on the phytoestrogen and its effect on breast cancer, and there's nothing which says that it has any effect on breast cancer. Actually, it's supposed to be protective. The phytoestrogen it has a similar estrogen structure, but not necessarily the same kind of effect. So soy is completely fine to have. You don't have to worry about breast cancer. Some men are also worried about having feminizing gynecomastia and all of that. So nothing, I mean, none of the studies which are to date have any data suggests that that's true. So soy is fine, and soy is a good source of protein. It's a complete source of protein.
And usually what I tell my patients is go with the least processed, right? So today completely we're talking about, unprocessed foods. So when we talk about soy, I usually say start with soybeans, tofu, tempeh. The highly processed soy foods is what we kind of shy away
Yeah,
from.
the meal maker and all is something which is best avoided, though it is very easily available. So the other thing I would like to say is with all the pulses and dals and soy also, people are worried about the anti-nutrients, so-called the phytates, the lectins
That's
and all
right,
of
that's
that. But all of those get very much reduced whenever you cook it. So most of us are nobody's going to have chana raw. So we are going to boil everything. So everything is boiled and cooked. So whenever you do that, all these anti-nutrients go down. And whenever we're using a drug, and we're wondering whether you can use it or not use it when it's in the kind of borderline, you always have that one sentence saying that if the benefits, you weigh the risk and the benefits, and if that outweighs the risk, you use it. So plant foods have so many phytonutrients, phytochemicals. I mean, we've heard everybody talk about that. So to not take a plant product because you think that the anti-nutrients are there doesn't make sense. Because the anti-nutrients are going to come down, you're going to cook it, and it's not going to have so much of an effect.
Thank you, Dr. Nitya. And Dr. Jayashree, should we avoid soy products in thyroid problems? I mean, you already debunked goitrogen food and millets.
Yeah, I forgot to talk about soy. But no.
I kept that question,
Thank you. Absolutely no change in your diet apart from what you're going to do anyway to lose weight or, for the thyroid.
And the one other thing that we commonly hear is, especially Indians, right? We have apple form of obesity, a lot of weight around the belly. And typically what we hear is, yeah, eat everything, don't worry about that. Let's just go and exercise, So can I do 100 stomach crunches and get rid of the belly fat? Dr. Arun?
Oh, why you asked me this? Okay, so great question. So unfortunately, I've already said this, fitness is not something that's emphasized in our Indian society early on, right? And people have this, first part reduction doesn't work. So if you think you can just do abs and think that you're going to get a six-pack, I have good luck to you, right? It needs to be a comprehensive strategy if you want to stay fit and healthy. And I would say 80% is your nutrition. Of course, there's a genetic component, not everyone's going to have it. And the goal is really not about flat abs. It's about avoiding visceral fat as much as possible, avoiding the truncal obesity, which clearly portends with a lot of the endocrinological stuff as well as with cardiovascular adverse outcomes. So you definitely need to get your aerobic activity in. And I would say just try to get at least 30 minutes, maybe 4 or 5 days in a week, along with strength training. That's the other thing that we don't talk about. And this would be on the fitness side. And the more important component is everything that we've talked about thus far with nutrition. Definitely also get enough sleep, because if you are trying to lose weight and you don't get enough sleep, again, good luck achieving that. So, yeah, manage your stress, of course. So it's actually really simple, because if you think about it, good lifestyle helps everything. Most of the diseases that we talk about, including cardiovascular disease, overall looking better, your skin, your abs, whatnot.
So for a flat belly, it's diet, and keep your cortisol down with sleep and stress. I think I got a phrase right there.
And some fitness, right? And some fitness, yeah.
Strength
for sure.
training.
Strength training and some aerobic activity too. Aerobic and strength training.
Wonderful. I have one, maybe a silly question for Shiny, but I always get trumped with this question when my patients ask me. Do I absolutely have to soak my almonds? And should I drink the water or should I throw away the water?
Yeah, that phytic
Should I
acid.
should I peel it?
Yeah, should no,
Because
no.
by the time they
You're
tell me
getting
this time-
fiber. That phytic acid will not kill you. So I think it's okay to eat. In case you forgot to soak, it's okay. You just eat it raw. That's fine.
And the water?
The water you can drink.
Okay, and one more. Can I mix my fruits and nuts?
Yes, of
My
course.
patients confuse me now.
Okay.
They come across all these things and they're like, okay, you can't mix fruits and nuts. And when do I eat my fruits? Should I eat before my food, after my food? So
And they wouldn't pay attention to sleep and exercise and eating a variety of vegetables, right? So they would go and micromanage this and miss out on the other aspects, the elephant in the room,
Yeah.
right? Oh no! What about the hydrochloric acid? And I totally get.
So I mean, if you are deciding to eat mangoes and 10 p.m., then you've really broken. You've not learned anything from this nutrition course today. But what Mr. Shiny is trying to tell us is, please eat your fruit. Stop worrying about when, what, how, mix. Eat your fruit. Focus on the low glycemic fruits and kind of go from that.
and eat seasonal.
Yeah, another thing they ask is like that citrus fruits should not be mixed with other fruits, or again, that do you believe in that?
Okay, so it comes from different schools of thought. If it's Ayurveda, Siddha, Unani, then you have the Sattvic diet and all of that. So it depends on what you choose to follow. But then as far as allopathy is concerned, there's nothing of that sort. So you can go ahead and eat it. But again, citrus, you do not make a milkshake out of it. It's going to split. So neutral fruits like apple or pear is better if one is looking at milkshake. And in Ayurveda, it's a big no-no. Milkshakes are should not be consumed because of it's wrong food combination. So I guess, see, when you really start looking too much, at the end of the day, you won't eat anything. You just have to live on fresh air. Right? So can we get a little practical and just make life a lot easier? In fact, there are people who can actually meal prep because they're trying to get everything in order and then they never get started. So I think the idea is to just make it easier and make the best use of weekend and shop for all the vegetables and the fruit, plan for the entire week, make your chutneys and tahiyals and karvapla podi and murungala podi, and then all of that, then it's much easier. All of us are out to work and then you might not be able to get everything in, right? So meal prepping helps a lot because then there again they'll say, there'll be a lot of nutrient losses. What do I do? You're trying to get everything right and one never gets started. So I think that's the problem with a lot of them and too much on social media. Anyone who loses weight becomes a dietitian. Anyone who eats 3 meals a day becomes a dietitian. And I'm sure my dietitian colleagues would agree with me how frustrating it is. In fact, that's the main reason why I got on social media. Who's that? Can I? Yes, Jayanti ma'am. My super senior is here.
Everybody's a dietitian, everybody's a
Everybody.
wellness coach.
Yeah, absolutely.
And those blueberries in that little box of 400 rupees actually scare me because I wonder when they got picked, what was sprayed on it that it is still fresh after 2 months. So then you wonder. They are,
You're
I'm sure,
right.
yeah.
And a box of cherry was 700 rupees. I went yesterday to the market to check. 700 rupees. Meaning how many can afford consistently? And you wait for the avocado to ripe and then it ends up rotting.
Yes.
Right? That's what
Oh my
happens to avocados.
You
So
wait
the
and you wait
influencer
and the next
probably-
day it's like gone.
Yeah, the influencer probably gets a box of avocados from Avocado Association. Right?
Does the audience have any questions?
Wonderful, wonderful panel. I thoroughly enjoyed. Great meal, actually. So my question is, I'm a general surgeon, so many patients ask me, diabetic patients whom I'm going to operate, can I eat fruits? Can I eat fruits? I'm a diabetic, what do you say?
I'll tell you what I say and then I'll listen to what Shiny says. When sugars are very high and we are trying to put them on a low carb diet, I tell them to avoid all fruits. Any fruit is going to spike your sugar. When you've achieved your sugar control, when you've lost weight, after that it's okay to include fruits in moderation. I don't think fruits are necessary. I think fruits are helpful. But when you're trying to lose weight or to control the sugars, I think you have to go off fruits. Unless, you're getting constipated, then include a fruit or two. but you don't need to have. So quite often I see women who keep having like a fruit shake in the morning and then come and say, no, I've not lost weight. And the only thing that they need to do is to, take the fruits off. So it depends on their sugar control at that point in time.
That's a fantastic question, because a lot of people will say, I don't like vegetables, I don't mind, I can eat 10 fruits a day. That's what they say. And even people with PCOS or NAFLD, and of course diabetes, they really go overboard. It could be like one full papaya, or else like half a watermelon. And fruit is healthy, so they end up taking it. And the most popular ABC juice. Oh my God. Okay. So the thing is, you really need to draw a line. So apple, pear, guava, and then we also say you can have fruits which are high in fiber, less in sugar. So the fructose content is very important, and also the portion sizes. So when I say a cup, the cup that you have in mind and in my mind could be very different. So I think the portion sizes, in fact, to show them the cups, we give a set of measuring cups to the client, and we tell them exactly this is the amount of fruit that you're supposed to take, and no juices, no milkshakes. And there was this smoothie thing that was doing its rounds, and that really went overboard. And again, mango season. Okay, someone sitting in Mumbai spoke about mangoes being great, but then what happened is an Alfonso in Maharashtra is small, but then here the Banganapallis are so large. Do you understand? So again, which variety of mango, how much to take, in what form are you going to take it? Are you going to make like a mango mousse, or is it a mango milkshake, or else, all of that. So those specifications are communicated by dietitians. We sit and talk to them for 1 to 2 hours in order to just clarify all of this. So usually fruits, if the HbA1c is really high, as ma'am mentioned, it's better to avoid for a while and focus a lot on vegetables. Avoid all the roots and tubers. So carrot, beetroots, potato, colocasia, yam, and also yellow pumpkin is avoided. Sweet potato too. You know about the sweet potato fries, how famous it is. So a lot of people end up eating that. It's just that it has plenty of starch. So we cut off all this and plus the fruit, and then gradually as they gain a grip, then slowly introduce some fruits. So it's very subjective, depends on the A1C. Yeah.
I'd just like to add that portions are very important. So it could be like like idlis are supposed to be very healthy, right? But I have patients coming to me and saying 5 hours, and I always ask for a dietary call, and the measuring cups are there in my OP. I have measuring cups, and I open them out to ask patients, tell me how much rice you have. So idlis are usually 5 or 6, dosas are 3 or 4, and there is no vegetable with the idli or the dosa. There'll be either tenga chutney or there'll be podi with oil, right? So we have to emphasize on portion control. Portions are important, and it's not just about eating. Like she said, if you have an entire watermelon, it's not going to do you any good.
I have a question for Jayashree ma'am. What is your say on pink salt and its iodine content for the thyroid patients? Because people are fancy about the pink salts and the whole foods, unprocessed foods, but because it doesn't have iodine in it, right?
Yeah, so you should not have only that. You will, particularly if you're a vegetarian, you're not eating fish, you are going to land up with iodine deficiency. So what I give practical advice, and Shiny is just waiting to come in. I tell them use 1 teaspoon of iodized salt, and the rest of it use as rock salt or whatever, pink salt, Himalayan pink salt. So we have enough food, put all of this in your rasam and all that, the rock salt, and use this for a little bit for taste in your vegetables. It is important to include some iodine in the diet.
I get a lot of questions from my patients saying they think pink salt is not salt. So it is salt. It just has some minerals and nutrients which gives it its color, but maybe my percentage is wrong, but I think it's 99% salt anyway. And the same thing I would also like to clarify, a lot of people who are trying to go healthy and do the brown sugar, I think brown sugar is scary. And I'll tell you why, because we think it's healthy. So if it was refined sugar, maybe I'll get away with half a teaspoon because I'm being careful. But in my mind, I'm thinking brown sugar, I'm healthy, and I'll definitely add a little extra. So I think sometimes these brown sugars and the pink Himalayan salts, I think they take us in a completely different path.
Ma'am was saying that, for now, millet dosas are actually in the run, right? And we are actually mixing these millets with fermented batter. And ma'am was saying that fermented millets is going to be goitrogenic. So is that actually acceptable, ma'am?
I don't. No. So I was saying, so in that, at least in Africa, the way they ferment the millets is they ferment it for 2 weeks. And I have not seen any, there are studies from India, and maybe Shiny can say, but I have not seen any studies which have shown that the way millets are prepared in India has high levels of goitrogenic substances. And ultimately, remember, whether it is rice or wheat or millets, it all has the same amount of carbohydrate. Okay, so eat less. That's one message you need to take home.
See, one thing, what happened last year was the year of millets. And there was an overdose of information and also the kind of food. So millet, murukku, pakoda, everything became very healthy. Or rather, that's how people felt. Okay, so another thing with millets is, see, traditionally farmers ate it. And they used to walk a lot. And they would pound it, ferment it overnight. And the next morning, they would make a gruel out of it and carry it to the farms and have it. So this is the kanji and the kuru and all that. But what you get in the supermarket these days are all these pastas, noodles and the vermicellis are not fermented. Okay, so it depends on what form, what you're using. Next is we are all sitting in our AC offices, clinics. Okay, and we really don't go out, sweat it out, and exercise might be out of the window. And if you're not walking, moving enough, and millets also have adequate carbohydrates, though it has more vitamins and minerals and other micronutrients and all that, but you have to take into account the carbohydrates. So it became a license to eat more. I'm not on white rice. I'll eat how many ever millets, millet dosas and idlis I want, and that's where things went wrong. And then there'll be a snack with a lot of millets, and it doesn't help. In fact, a lot of gastric issues came up. So everything in moderation. When you're starting, don't do multi-millet porridge mixes or chapati mixes. Just do solo millet and try it either for breakfast or for lunch. That's when you're most active during the day, not for dinners. So I think these are those small things that one could pay attention to, and then just do one millet a month and then graduate to the next, if at all you want to use it.
So millets or soy or any of those, the more processed you start making it, you're really losing the benefit right there. And also I wanted to add with carbohydrates, right? When patients say, okay, can I eat potato? Can I eat sweet potato? We are seeing quite a few studies that are telling us sweet potato, there's a lot of fiber and it's kind of good. All I tell them is to cut down on the rice and to add that, consider it as a carb, not as a vegetable. It's only when you do your rice and urlakaranga and yam is when the problem starts coming.
Just to kind of follow up on this, right? Many times, she's just talking about the millet, the multigrain dosa and all this stuff. It's not just the grain that you're talking about. It's how you make it. Many times as a dosa, they probably add generous servings of oil and it's just done. And then you have something along with it. It's all the other stuff that goes with it. So just, keep it clean if you really want to study that effect. And the same thing when we talked about eggs too, right? It's all the other garnishings that go with it. Sorry, there was another question.
Thank you for the wonderful panel discussion. I just have one question. Does gut microbiome produces short-chain fatty acids? Are there any reliable food sources which is rich in short-chain fatty acids? More clarification on that one.
I don't think there are any food products which are high in short-chain fatty acids. They are produced in our gut because of the microbiome and because of the fiber. They need the fiber to produce the short-chain fatty acids.
When you eat a food which is high in cereals, grains, nuts, oil, seeds, the type of bacteria that live in your gut will make more SCFAs, short-chain fatty acids. When you eat a lot more milk and animal protein, you make the bacteria which makes this go down.
Also, a lot of times, I eat dals and I get really bloated. I can't tolerate dals and vegetarian protein. So, what is all that about? So, can we just stop eating pulses and legumes? Actually, your gut microbiome starts to grow and starts supporting what you eat. So, what you put in is what your gut microbiome is going to be. So if you keep putting in burgers and pizzas, it's the bad bacteria that's going to grow. But you keep adding fiber, and that's why the dals are such superfoods, because they have such a wonderful combination of protein and fiber. So initially your gut microbiome may not like it, but that's just telling you that you've got not so good gut microbiome. So you've got to teach it. So you have to start with small quantities, introduce, let the body get used to it, and then keep increasing but don't think that, oh, I'm bloating, so I can't really do it. You have to teach your gut microbiome and make the good bacteria grow. I think there's one more question.
This is more about fitness. So a lot of people from the older generation, like my parents, they're very against strength training. They feel, you shouldn't really do a lot of the strength training. Cardio is enough. Just walk. Why do you go to the gym? So there's always this wrong consensus about strength training being really looked upon and that it's not needed. So is strength training really needed, or is a healthy dose of cardio enough to maintain your parameters?
I think all of us are excited. Because I have the mic. So I'm going to cheat and I'm going to say such a huge misconception. Sarcopenia is like such a big problem, but I'm not going to say the rest.
I'll let ladies first.
No, strength training is very important for everybody. Everybody needs to strength train. Especially if you're elderly, you definitely need to strength train, because if you strength train, their bones, joints will get better. They'll be more stable. You reduce the risk of falls and fractures. That's what you're worried about when people are getting elderly, right? You're worried about balance. You're worried about fall. You're worried about fractures. Study after study shows that strength training is very beneficial, and definitely, everybody should strength train.
Especially your parents, you should tell them.
Yeah. So, yeah, I don't get. I wanted to add that, see, my mother is 75, my mother-in-law is 69. Okay, so after the pandemic, once we got back to normalcy, I actually hired a trainer, and they do kettlebell training at home. Okay, deadlifts and whatnot, and all her, the gait has changed. Okay, the posture has improved, and you know how I tricked them into doing it. So I told Amma, உங்களுக்கு கோயில் போகணுமா எங்கோட கூட்டிட்டு போறேன், நீங்க வந்து அந்த கார்ல ஏறதுக்கு உங்களால காலை தூக்கி வைக்க முடியல. So this is my mother-in-law that I'm talking about. So she said, all that I have to say is your glutes are weak. Okay, your hip flexors are tight. நீங்கள் வந்து இதை எக்ஸசைஸ் பண்ணிங்கன்னா எல்லாம் சரியாயிடும், எல்லா கோயிலுக்கும் போயிடலாம். ஸோ ஃபைண்ட் அவுட், இட்ஸ் அ கேரட் அண்ட் ஸ்டிக் பாலிசி. Okay, coax them, nudge them, but then ask them to do it, because if there is a fracture, then that's it. If they're going to be cooped up at home, it will be very difficult to see your loved ones being confined to a room and then not socializing. So they need to be out there. So however late it is. So I used to work in YMCA, and I've seen people who never went to any fitness class, but then post-retirement, at the age of 60, they were stepped into YMCA, and then they went ahead to go for international athletic meet. Okay, men and women, at the age of 80, they were going all across Asia, coming back with medals. Okay, so this is how, when I started my career, I saw this in Dr. Kannan Pogrendi's clinic, and it's amazing. So it's never too late. They just have to get started, and this is the best thing that you can do. The trainer charges a bomb, but I see it as life insurance.
I was just going to say one thing, right? Like, especially after the age of 40. So it's not a linear muscle mass loss that you have as you age. Till about 40, you can kind of manage. After that, you start losing muscle mass significantly every year. So do it at your own peril for all the reasons, falling, loss of balance. Everything requires coordination, so it's super important. It's not enough. And most of us, when we talk about aerobic, oh yeah, we'll just go for a jolly stroll and come back. That's not exercise.
Yeah, my women patients, I tell them to start strength training from the age of 30, and they don't get bulky. And all my older patients with knee arthritis, for all the orthopedicians who have said, don't climb stairs, don't do, oh, knee valikida, don't use it. That's so wrong, because then you're not using your muscles, which means it's basically going to keep getting worse. So knee arthritis, strength training is another big one that will help in the long run.
So I come to across a book called Eat as per your types. That means
Eat as per your blood type?
Yeah, blood type. So, is there any kind of scientific proven methods or whether we have to follow. But actually, in my family itself, we have 4 blood groups, but each one having a different way of eating, and that's what I just have a suggestion.
I think for me, I will say no is the simple answer. I think we should eat for our gut microbiome. I don't know.
So can you elaborate the question? Eat
Sir.
according to what type?
So actually, the book called Eat
Blood
as
type. Blood type.
Yeah, blood type. Yes.
Not really. Not really. I mean, there's no
Evidence.
I think I saw this thing a while ago, and as far as I know, there's no published literature that correlates with. I mean, dude, you can make that's one of the problems, right? To write a book, or I mean, even more, like to get on social media and say something, it's easy. And if the more outlandish it is, the more popular it becomes. Unfortunately, and it's catchy. It gets viral. So no.
Because some of the trainers, especially the gym trainers, they are suggesting some foods. I think you come across.
So especially with the gym, just one word of caution, dude. I don't know what quality control they have. Number one, number two, please don't take supplements from your gym trainers. I mean, we were talking about a lot of the stuff. It's rampant. People, I've actually personally seen. I don't see a lot of patients in OP unless they have real cardiac disease. But I actually saw a guy who looked super buff. Like, okay, I was like, man, this guy. So he walks in. His heart function was like half of what it should be. And then he's like, what's going on? So we did this whole cardiomyopathy workup where you have a weak heart. And then we find out that, no, I just get this, I've just used it a couple of times. It went down. So be wary of where you get your advice from.
Thanks for the clarification.
Thank you, doctor. This is a wonderful session. As a nutritionist, I'm very happy that doctors are discussing about the nutrition. I have one question for you, ma'am. I have one patient who is fluctuating between hyper and hypothyroidism. And I don't have a full history of her since I don't have any free T3, free T4 and anti-TPO. And her eyes are very big and she hardly had hair on her. She came for a one-time consultation. Is it okay to recommend cabbage, cauliflower, soya?
Absolutely. Absolutely.
Okay,
Yes.
thank you.
I would like to ask, what is the most common cause of grey hairs in young adults? It's very common now. Are there any lifestyle changes we can do to prevent?
Have you heard about epigenetics?
No.
Research about epigenetics. You will know why we have grey hair now. It is a lifestyle, 100% lifestyle.
I have a doubt about the twin studies. Both the twins will be following same amount of protein and will be doing strength training. But while the result will be, the twin who follows plant-based diet will lose lean muscle mass. I have a doubt about it. What is your say?
Okay, we have like gone all over. Okay, so the twin studies was as follows. So they were twins, identical twins. The primary endpoint that they were looking at is the cholesterol level, the bad cholesterol, LDL-C. Okay, I can share the details of the actual foods, etc., because it's actually available. But what they did was compare a healthy plant-based diet to a healthy omnivorous diet. So that was the thing. So there was no measure of muscle mass, etc. They were just looking at blood tests essentially to see if the cholesterol levels dropped in one versus another. And they looked at a couple of things, including TMAO, etc. But the primary endpoint, typically in a randomized trial, the primary endpoint is pre-specified. So sometimes you can do a post-analysis, etc., but the primary endpoint is pre-specified. Here, it met cutoff. It actually met this p-value, right? So what this basically means is that being on a healthy plant-based diet trumped in terms of your LDL concentration, it dropped it even more than a healthy omnivorous diet. That's all that study was about. The interesting thing was it was randomized and it factored in all the genetic variation typically because they took up identical twins. So they didn't measure muscle mass or their functional fitness or anything like that. It was a nutritional thing.
I saw that in the new Netflix documentary and even studied about the article about it. And for LDL, the plant-based following twin will be losing 1% of LDL and the meat omnivorous group will increase 0.3% of LDL. But the muscle mass will reduce for the plant-based twin. The muscle mass will reduce up to 6%, while the only 3% for the omnivorous diet.
So
The percentage is very, for the lean muscle mass, the percentage is very, and
So-
we as a youngsters, we thought lean muscle mass is so important. So instead of going completely plant-based, following a balanced meal with good amount
So
of.
that was what the study was all about. And again, we could discuss this at greater length, but in general, right? For example, HDL also dropped in the plant-based thing. So usually you have pre-specified cut points, like just because a percentage drops, as long as it reaches a significant p-value, and again, usually it's defined as less than 0.05. It does not merit, it could be a statistical change, it could be a natural variation, etc. So not everything that you see as a variation now matters. Number two, again, how intense were their physical activity, etc. I mean, honestly, I'll have to go back and double check this. So it's kind of hard to comment about it. But the whole idea, the point of saying that was that it is one of the most effective ways of reducing your bad cholesterol, which clearly correlates very strongly with adverse cardiovascular outcomes.
Adiposity was, visceral adiposity, the visceral fat was actually coming down much better with the plant-based diet. Second part is the aging parameters. They looked at 4 aging parameters. That was much better with the plant-based diet. So when you look at all these things, when we hyper-focus on the muscle mass, definitely you feel that omnivorous diet is better. But look at all the other parameters. And recently, when there is another study which came, nurses study, there was a sub-study which was done in Fremont nurses. Nurses are supposed to be very healthy. That also shows that the kind of 4 parameters of aging were checked. One was actually your mental, your sarcopenia, the muscle, your physical agility and stuff, and cognitive performance. The people who were having a higher plant intake, or people who were less on animal products were 30% or more compared to the people who were higher on animal proteins actually. We're having higher performance on all these parameters. So don't look at only the muscle part of it actually. See, muscle, when you're looking at the plant animal proteins, muscle we will get a better this thing with animal proteins because it has a better stimulation and stuff. But you should also look at the aging parameters. mTOR, there is a protein which is associated with aging, which get activated, you will faster age. It is not something which is said by the so-called biased WPB people normally, the medical fraternity says, but it is done by scientists like David Sinclair and maybe Dr. Christopher Gardner, who are actively doing research on aging and health. Please look at all these things actually. Don't look at just the muscle part of it actually. Thank you.
So thank you so much for all your patience, and we do not recommend late night dinners, so sorry about that. We will end this with one last comment from Dr. Arun.
Yeah, just from a performance standpoint, etc. Just as a side note, great that Regina brought up all this stuff, but something that I do want to emphasize is that for a lot of people that are into fitness, many of them, and this has been a well-documented phenomenon, where people actually push harder by going on an ultra, just as a plant-based thing. Again, the key point overall is, eat less processed stuff, eat more whole food plant-based stuff, less sugars, less greasy stuff, be kind to your gut microflora, eat, less often, and space it. What's the other thing? The one other thing also is about eat less often, and when you're eating, eat mindfully. Like, don't multitask and eat. So how you eat, what you eat, and when you eat, I think are all 3 important components when it comes to diet. Thank you.
Thank you.